Good afternoon and welcome back to Let's Talk About It. My name is Melinda Salinas and I'm a Community Relations Specialist with DC Health. This week, we are celebrating Emergency Medical Services Week, and this year's theme is EMS, where emergency care begins. So in today's segment, we will focus our attention on the important contributions of EMS practitioners and the work that they do to keep residents and visitors safe in the nation's capital. So joining us to talk about emergency medical services, we have Daniel Burke, DC Health's Emergency Medical Service Manager, Abby Hames, Georgetown EMS Vice President of Operations, and Dr. Caleb Ward, Children's National Hospital Associate Research Director and EMS DC Program Director. So before we jump right into our questions, I would first like to have our guests introduce themselves and tell us what's the most exciting part of your work.
Hey, well, thanks for having us on today. My name is Caleb Ward. I'm a pediatric emergency medicine doc at Children's National, and I serve as the Program Director for Emergency Medical Services for Children here in the district. So I spend a lot of my time each day partnering with nurses, physicians, but more importantly, EMS clinicians across the district, trying to figure out how we can provide the best care to every kid who's sick or injured and needing the help of our emergency medical services.
Awesome, thank you.
Hi, I'm Dan Burke. Thanks for having me on as well. I'm the EMS manager here at DC Health, and I oversee the office that regulates the EMS system here in the district. The most exciting part about that for me is getting to help our broad spectrum of very talented EMS clinicians make our community safer.
Awesome.
Hi, I'm Abby Hames, and I am a crew chief and the Vice President of Operations at Georgetown EMS, the EMS agency on Georgetown University's campus. Part of my job is making sure that all of our day-to-day operations are happening. So a really cool thing about my job is just seeing all the little pieces and all the little aspects that all have to come together in order to make our EMS system work.
Awesome, great. Thank you. And thank you for keeping everyone safe too. So we would like to start the discussion and talking about it by kind of having you explain a little bit about what emergency medical services consist of.
Yeah, so emergency medical services is a system of highly skilled pre-hospital clinicians that respond to health emergencies and injuries and treat patients outside of the four walls of a traditional hospital environment. So you traditionally think of like the vehicles that we see on the street, right? An ambulance, a fire truck, or a helicopter in some cases. But that's really just where the system begins. It's much more than that. So the system starts with a really robust education system that's based on national standards that trains EMS clinicians to operate sort of at the crossroads between healthcare, emergency medicine, public health, emergency management, and public safety. And then at the other end of the spectrum, it allows the system to provide those operations that we sort of think of, in the field. In addition to emergencies, EMS plays a role in non-emergency medical care through interfacility transport, special event standby medicine, and integrated healthcare as well. And EMS is also importantly integrated into the larger healthcare system as a whole by maintaining strong relationships with partner organizations and healthcare providers, like our relationship with Children's.
Awesome, thank you. It definitely sounds like it's a intricate system, but that it plays a very huge role and an important role at that. Well, our next question is, what is the difference between DC Health's EMS program and the DC Fire and EMS or DC FEMS program?
Absolutely. So the DC Health EMS program is the district's EMS office. This is the same as a state EMS office in any other U.S. state. Mm-hmm. The EMS program is the regulatory arm of the district's government over the whole emergency medical services system in the district. This includes regulating EMS agencies, EMS clinicians, EMS education institutions, EMS instructors, and the receiving hospitals. DC Fire and EMS is one of our 15 EMS agencies that provides emergency medical services in the field in Washington, D.C., and it's regulated by us here at DC Health.
Oh, wow. Okay. So in essence, your program or division ensures that people have the proper credentials and training to be able to then partake in the system.
Exactly.
Okay, awesome. Well, a third question is that oftentimes, individuals tend to think of EMS in terms of members of our local fire department, or solely members of our local fire and EMS departments. Are there any other fields or places where we might find EMS staff?
So, of course, people immediately think of, our frontline first responders when they think of EMS, right? They think of, fire departments, emergency ambulance agencies, and even campus-based ambulance services. However, EMS does much more, as I alluded to earlier. One of these is interfacility transport. They play a huge role in the healthcare continuum by transferring patients from facility to facility, oftentimes very critical patients from facility to facility. And also, these same services get patients out of facilities back to long-term care or back into their home, so that they leave the four walls of the acute care hospital and actually go back into the community. EMS clinicians also operate in the special event environment. So they provide standby services for things like community festivals, concerts, and even things as big as presidential inaugurations, which are obviously very important here in the district.
Absolutely, yes. Thank you. That definitely does help to kind of clarify just where else we see members, and they're not only stationed at fire stations or things like that. Can you tell us a little bit more about the duties of our EMS program team members and how they contribute to ensuring the safety of district residents, workers, and visitors?
Yes, absolutely. So the district EMS program, the DC Health EMS program, is an interdisciplinary team that regulates EMS in DC. We have team members who work in the field conducting compliance inspections on vehicles and facilities to ensure that they're adequately and safely equipped. And we also have team members who work closely with our EMS education institutions to ensure that the content that's being offered meets or exceeds the national standards that are set for us. And then, very excitingly, we recently brought on a epidemiologist who's going to work to dig into the large store of EMS and trauma data that we have to better understand and monitor injury and illness in Washington, D.C.
That's awesome. Thank you. What are the differences between certified emergency medical responder, or EMR, emergency medical technician, an EMT, or an advanced EMT and paramedic? And how does someone become one?
Really good question. A lot of folks ask this. So EMRs and EMTs provide what's referred to as basic life support or BLS level care. EMRs focus on initial life-saving interventions, whereas EMT is actually the basic level, the lowest level to staff an ambulance in Washington, D.C. Advanced EMTs provide intermediate level care, and they have a few additional skills that a regular EMT may not have. And then paramedics are providing what's called advanced life support, or ALS, and they bring basically the emergency room to the street or to your living room or your office or anywhere in between, and to provide advanced level care until patients can seek definitive care.
Thank you. That's very helpful.
Yeah. So to become certified, it's available at one of our certified EMS education institutions in the district. And usually a person would seek BLS certification first, gain some experience as an EMT, and then would go on to further their education as an advanced EMT and subsequently a paramedic.
Okay, thank you. Thank you. And we can definitely see your passion in the work in the field that you do. Our next set of questions are for Abby. So what is the difference between DC FEMS and your college EMS service?
Yeah, so Georgetown EMS is 100% staffed by Georgetown University students. So in addition to being all certified BLS care providers, we're all also students on Georgetown's campus. We are also administratively run 100% by students. So all of our day-to-day operations, our licensing, and a lot of our educational opportunities are coordinated and run by the same people staffing our ambulances. Also, because we are all volunteers, we are able to provide our services, our care, and our transport free of charge for anyone who calls us, which is a really cool privilege to have in order to provide care for people without the additional burden or worry of finances. So that's what makes us a little bit different. We also are in a little bit of a narrower field to respond. We respond primarily to the Georgetown University campus and then the surrounding neighborhoods. So we're responding to our own community. We know our community. We know the people we're helping, and that's a really cool opportunity.
Thanks. That's definitely in providing such a critical service to your community too. I'm sure it's very fulfilling. What benefit does your college EMS program provide to the DC community? Share a little bit about offering those emergency care services to the community, but is there anything else that you want to elaborate on?
Yeah, so at a base level, we provide free BLS emergency care and transport to anyone who calls us. So you don't have to be a Georgetown student. We respond a lot to people just in the surrounding neighborhoods. And then as community members, we're we're well known, we're well trusted, and we have that privilege of providing care for people who are perhaps worried, but they see us all over campus. They see us in our ambulances and know that we're someone they can trust.
That's awesome. What public education opportunities does your organization offer?
Yeah, education was one of the founding principles of Georgetown EMS, and it continues to be one of our core values. We offer a ton of different educational opportunities. Our biggest one is actually our BLS EMT class. We offer 3 a year in order for people at Georgetown University, as well as in our surrounding community, to get their BLS certification. We also offer a number of AHA CPR classes. So for people who want to get that CPR certification, our own members who are AHA instructor certified provide those classes. And then in addition to some of our more like structured class type settings, we also do a lot of community outreach and tabling and stuff like that to provide education on a wide variety of different medical scenarios or medical topics, such as stroke response or sexual assault awareness, or even like stop the bleed trainings in our Red Square on campus.
That's pretty awesome. Also sounds like those are additional things that you offer your community as a whole. So that's pretty cool. And the connection there, I'm assuming, is that your program oversees part of that compliance and ensuring that their program is up to par with all of our standards or nationally accredited.
Yes, we make sure that both their operations side and their education side meet at least the national and DC standards, if not exceed them, which they do a great job of.
Well, our next set of questions are for Dr. Ward. What are emergency medical services for children, or EMSC?
Yeah, so there's a little bit of alphabet soup here, right? Like we've got all of these different acronyms and they all sort of sound the same, but there's some important differences. So EMSC is actually a federal grant program funded by the Maternal and Child Health Bureau at HRSA. And every state and territory in the country has one of these organizations. And it's a group of folks who are tasked really with improving the emergency care that kids get when they're sick or injured, right through from preventing through to the acute response, their care in the hospital, and ultimately their rehabilitation and recovery. So we partner with kind of a lot of different folks. We partner with Dan and his team at DC Health, but we also directly partner with EMS agencies to try and address that continuum of care, because we know kids are different than adults in a medical emergency.
Thank you. How does EMC DC interact with and support EMS agencies in the area?
Yeah, so it's the best part of the job, really. And so we do everything from educational outreach to quality improvement initiatives. So if we see a problem that is affecting kids across the country, getting a group of folks together and saying, how can we move the needle here? How can we make care for kids safer? So for example, how can we make sure they're getting transported safely in the back of an ambulance? Which seems pretty obvious, but when you've got a squirmy newborn baby, how do you do that? How do you get them secured safely? And that's an area that's surprisingly controversial and hard to do well.
That's a very good example.
Yeah, it's what we come up with a lot. It's important to draw the distinction there from the other role that we play, right? So when I'm working as an emergency doc, that's the direct clinical feedback, right? A paramedic bringing in a kid in cardiac arrest, delivering care, bringing us that patient, and us debriefing and providing care on that exact scenario. Whereas what we're really doing at EMSC is thinking about the system as a whole and how can we improve the care across the board.
Yeah, thank you. And thank you for those great examples of thinking that in that way as well. What are the challenges of providing care to children in EMS? You mentioned, for example, the squirming child in an ambulance. Is there...
Yeah, there's a lot, and I can probably talk to some of these. Ultimately, kids represent about 5 to 10% of all EMS transports in EMS agencies across the country, and the district is no different to that. We know, so right off the bat, EMS clinicians are not seeing very many of these calls. They may only see a couple of pediatric calls each shift they run. What we also know, happily, is that most kids, even when they call 911, are not seriously ill or injured. So it's probably only about 1 in every 100 calls that go to any pediatric calls to 911 involve a seriously ill or injured child. So a paramedic could go their entire career and never have to put a breathing tube in a kid. Or they could go 10 years in between cardiac arrests of a child, thank goodness. But it's real hard to stay up to speed with the latest evidence, to make sure your skills are really good when you're seeing something like that so infrequently. And then you add on the high stress of the situation, right? Those are highly stressful environments, really stressed families. It's stressful for us as medical providers in scenarios. So it's just really hard to do a good job in those scenarios. And so it makes it all the more important that we as a team are supporting our frontline EMS clinicians, that we're doing research to figure out the best way to care for those kids, but that we're also supporting them with education. And that might need to be innovative. DC Fire and EMS has an amazing simulation suite. So it kind of looks like the back of an ambulance. So we don't have to just sort of say, use your imagination at this desk when we're trying to teach you how to put a breathing tube in a kid. We can do it in a room that's got a screaming kid sound in the background. And it kind of adds to the realness of those scenarios. But those are just some of the ways that providing pediatric EMS care is hard. And my hats go off to all of our EMS clinicians who are doing this every day.
Thank you. How do we make sure every EMS agency is prepared to care for children?
Yeah, so we touched on this just a little bit in the last answer, right? Part of it is education. There's a national program, the National Pediatric Readiness Program, that gets at exactly this. And part of how we get ready is by having the right equipment in every ambulance. Part of it is, and that's where what Dan and his team does is so important in terms of regulatory oversight and inspections, right? It's no use if your kid has an ambulance pull up and they don't have the right size breathing tube in the vehicle. So it's things about equipment, it's about education. So making sure that they're not just meeting, but exceeding the standards in terms of hours of pediatric education, not just once when they qualify, but all the time when they're re-qualifying and keeping their skills up. It's the same for any of us in our jobs, right? You don't just learn something once. And then it's about the policies and procedures so that they know where to take a kid. They know that if they've got a kid who's in cardiac arrest, which hospital should you be going to? And if you've got a disaster, which other hospitals are available in the area? How do you deal with it if a hospital's on downtime because their electricity grid has gone down? All those sorts of things that you need policies and procedures for. So I think it's really about three things: equipment, personnel, and then those policies and procedures. And if we together across the system can make sure that every EMS agency has got that, chances are when you call 911 for your kid, the ambulance crew that turns up is going to be ready to take great care of them.
Thank you. I think across the board, we definitely see the passion and the great and importance of the work that you all do. So thank you for sharing and answering a lot of these questions. Our last question for all of our guests today is, what advice do you have for anyone looking to into starting a career with EMS or specializing in a particular type of EMT or EMS role?
Abby, do you want to go first?
Sure. I would say jump in. There's so many opportunities at a wide variety of ages. I got my certification when I was 19. Some states start even younger. So get that cert, or a lot of places offer ride-alongs or experiences where you can kind of test the waters, see if this is for you. But I would definitely say find an opportunity and go for it, because there are genuinely so many opportunities to get involved.
I would just put two extra plugs. One, we need all of our community to be interested in a career in EMS. For too long, this has been, like many aspects of our society, a not particularly diverse workforce. And we need our healthcare workforce to reflect the community we serve. And that's nowhere more important than in the district. So it is super important that all of us involved in recruiting and training are creating a welcoming environment. And if you are in any doubt as to whether you could see yourself in this field, the answer is yes, and we need you. And the second is to encourage people to think about the flexibility and the long-term career options that are available here. The healthcare workforce of 2050 is going to look nothing like the healthcare workforce of 2023. And people really value the set of skills that paramedics and EMTs have. They're adaptable, they're flexible, they can think on their feet. And those skills absolutely are valuable in the back of one of those vehicles there, but they are valuable across our healthcare system. And so the opportunities and different places a career could take you if you make that first step are endless.
Thank you.
So I think as both of our guests here alluded to, there's lots of opportunities to get involved. Specifically here in DC, there's plenty of need for our community members to become interested in a career here. And you can have a career in EMS, and it's an awesome career. It's very rewarding, and I highly recommend it. It's interesting, though, because EMS is still growing. It's one of the newest healthcare professions. In fact, we can only trace the roots of the modern EMS system back to like 1966. By contrast, the nursing profession as a formal profession is several hundred years, if not older than that. So there's lots of continuing evolution that happens in our field that make it very interesting. And EMTs can now do more now than ever, and paramedics are able to deeply specialize into critical and specialty care arenas in flight and transport medicine. And additionally, careers in EMS can lead down rewarding administrative and policy pathways that can make communities safer for everyone.
Thank you. That's definitely important. So it definitely seems like there's a call to action there if anyone is interested in a career in emergency medical services. So thank you again for joining us to commemorate EMS Week. This kind of concludes all of our questions for today. We would also like to thank, of course, our guests for joining us and the work that you do to ensuring that all the systems, from the ambulances to the training to the care that we provide, keeps everyone here safe. And that we're staying up to date with research and kind of improving that. We hope you've enjoyed today's episode and have learned a little bit more about emergency medical services in the District of Columbia. Don't forget to follow us on social media to learn more about upcoming events and other health news. Until next time.